Let's talk about the principle of double effects when it comes to end-of-life care, palliative care, cancer care, advanced cancer care. Now, double effect is a principle that helps us, we, clinicians, doctors, and advanced nursing practitioners, helps to guide our decision making when administering certain medications in patients who are undergoing or who are in the process of palliative care or end of life care. Let me paint a scenario. A patient who has an advanced cancer or advanced multiple sclerosis or advanced Parkinson's, and they're in the process, they're in the stages of, they're close to the end of their life. Let me put it that way. And these patients could commonly be in distress without medication. So some patients, patients with advanced cancer, for instance, can be in a lot of pain. They could have shortness of breath, respiratory distress, excessive secretions from their throats and and their chest that will just make breathing very uncomfortable and distressing. These patients could be confused and agitated. This kind of symptoms could be going on. Now, there are medications we commonly administer to help control, alleviate these symptoms. Medications like morphine, strong painkillers, morphine, diamorphine, things like levomethomazine to suppress secretions and vomiting. And sometimes we give medications like midazolam for agitation to calm the patient, because at that stage of the person's life, what we want to prioritize is comfort. We're not trying to prolong that person's life because we know that this person is at the later stages of their life. We're not trying to prolong life. We're trying to ensure that person is as comfortable, as symptom-free as possible. The double effect comes in because a lot of these medications would usually create unpleasant side effects like deep sedation. So morphine, levomethomazine, midazolam, these kind of medications have the side effect of sedation, so the drowsiness, and obviously as the person's pain level increases, we have to give more and more morphine or diamorphine, to control their pain, bearing in mind that the more morphine we give, the more sedated that person becomes. Usually our target is to make sure we control the pain while making sure the person is still as conscious as possible, to be able to interact with their family and the environment. Sometimes we have to give higher and higher doses of morphine or some of these other medications, and then the person's level of consciousness will be going down. That's where this double effect principle comes in. You're trying to help them while bearing in mind that the side effects of those medications might make them no longer being able to be conscious of the environment, and their family members could become distressed because the patient may not be able to interact with them. They may want to have a little chat with that person, and the person is